Thyroid eye disease. It's also called Graves' ophthalmopathy. It is most commonly seen in female sex and those who smoke and in middle age. Pathogenesis. It is an autoimmune disease. Orbital fibroblasts have similar antigen to that of thyroid follicular cells. So the T cells induce the fibroblast proliferation and adipogenesis. As a result, extraocular muscles are enlarged due to edema as well as infiltration. Coming to the clinical features, exophthalmos, otherwise proptosis. Proptosis in thyroid disease is called as exophthalmos. It is seen in 60% of cases. And optic neuropathy, due to the direct compression of the nerve or the blood supply, and the conjunctiva is chemosed. Coming to the most difficult lid signs. First, Dalrymple sign. LR, lid retraction. So it's mostly in the upper lid retraction. There is a sclera, removed sclera is seen between upper lid and cornea. Then coming to other signs, Stellwag sign, Rosenbach sign, von Graefe sign, Geoffroy sign, and Enroth sign. Here remember a person, Stellwag, he's staring. Stellwag staring and staring at a girl, and he goes to give a rose. And in fear, there is grief in him. Later she accepts and he's joyed. He enjoys. Then enroths with happiness. Now Stellwags. First the person is staring, right? Stellwag, ST, staring. There is infrequent blinking. And then he goes to give Rosenbach. So there will be tremors on closing lid. While giving rose, he is scared of her. So there will be tremors on closing the lid. Then he is scared whether she will accept or not. So in grief, on moving the globe downwards, there is lagging of the lid. And as she accepts, he is joyed. That is, when you see upwards, the forehead wrinkles are lost on that side. Enroths. With happiness, the eyelids are filled, that is fullness of eyelids. Then other sign is Mobius sign. This is a motility defect, ocular motility defect, due to the immobility, partial or complete immobility of the extraocular muscles. And coming to the treatment, non-surgical treatment and surgical treatment. And non-surgical treatment, it is by giving artificial teardrops and systemic steroids or else radiotherapy. And combined therapy includes steroids and radiotherapy. And then surgical, extraocular muscle surgery, eyelid surgery, and orbital decompression surgery. Extraocular muscle surgery, that is recession of inferior rectus muscle. Recession in the sense, the muscle insertion, where the original insertion of the muscle is there, it should be removed from that original insertion and placed in some other place. That's called recession. Then coming to eyelid, levator recession and lower lid retractor recession and blepharoplasty. Blepharoplasty is removing the excess of fat from the eyelids. Next, orbital decompression surgery. It's of 2-valve, 3-valve and 4-valve. In 2-valve surgery, the floor of the orbit and the medial wall are removed. A part of them are removed. Coming to 3-valve, along with the 2-valve, the lateral wall is also removed, a part of lateral wall. In 4-valve surgery, 3-valve plus a part or lateral half of the roof is removed. Thank you.